From stress to anxiety to depression, students' mental health has been strained by radical changes to life that fell heavily on America's children, and educators are trying to respond. One school district in Allentown, Pennsylvania, which serves around 9,000 students, has partnered with a local hospital to link middle and high school students with licensed clinicians for therapy sessions one-on-one. Brenda Dorenzo is Parkland School District's Director of Student Services.
One of the biggest things that we did was to partner with St. Luke's, and St. Luke's provided a therapy component to our school. It's called the YES program, and St. Luke's Hospital sent one of their psychotherapists into our schools, and they provide counseling services to students who would need that degree of help.
Educators across the country agree students' mental well-being became a bigger priority after the pandemic forced schools to shut down or operate with a mix of remote and in-person learning. Some students struggled to focus, and isolation, worry, and depression took a toll on many. According to a Reuters survey of U.S. school districts serving more than 2.2 million students conducted earlier this year, the majority of students reported signs of mental health issues.
The worst thing you can do for a kid who's anxious about coming to school is letting them stay home. And here we had to. So now trying to get those same kids back into school, how are we going to do that? How are we going to encourage them back? How are we going to build those connections again to get them healthy?
Eighth grader Sarah Lundberg says remote learning was a struggle. Still, she was anxious about going back to school.
My anxiety about school and actually going to school and my social anxiety kind of went it went a little bit up because I was going back to school, but I was very I'm glad that I had that social aspect because that I wasn't getting it at home. So it got better when I went back into school.
Concerns about mental health have led to a flood of new funding and initiatives aimed at helping schools navigate the pandemic's aftermath. The federal COVID-19 relief package passed in March included $122 billion for K-12 schools to implement strategies to meet the social, emotional, mental health, and academic needs of the hardest-hit students. And a White House budget proposal released in April includes another $1 billion to add nurses and mental health services in public schools.